Our next speaker is Katia Lukicheva, and we are very lucky to have an experienced contributor to decentralized bottom-up budgeting in Ukraine as one of the active members of our radical exchange community. Katia's experience in Ukraine shows the democratic impact of public participation, also in allocating resources locally. Welcome, Katia. Wonderful to have you here.
Thank you. I'm also very excited to be here, and I will actually not have a presentation because I'll do something a little bit different. I'll tell you a story. And it is a story about the systems transformation, because I think everything what we have heard today and what we have heard from Alexandra now also is about the tools that we have that enable this. And I would like you just to have an idea of how do these tools enable the impossible become possible. Ukraine, for me, is the story of the impossible. You know, when the war started in Ukraine, I was coordinating aid with a lot of local groups on the grounds. And the response that I heard from a lot of the donors is that this is impossible to move this so fast. It's impossible to mobilize this. It's impossible to mobilize that. So what we decided as a response is that we launched a campaign and we filmed a video that was called The Impossible to illustrate to the international community that Ukraine is the story of the impossible. You know, throughout its history, it has done everything against its odds, to protect democracy and to be resilient. And I think we need to remind the international community today that it is the story of the impossible, and that we also called on the international community also to actually also step up the courage and resilience and try out the impossible in this current context. So anyway, my work has focused mainly on financing and governance. The reason that I have focused on financing and governance is because this is where the intersection of money and power when it comes to allocations for public resources. So I've worked both upstream, influencing the reforms and the policies, both of international financing institutions, but also at local level with the governments and the ministries, but also at the very bottom-up level with the civil society, with the communities, to really make sure that health is a priority number one, that human lives are really showing up in the budgets and in the spending, right? And to translate this into a very visible public policy. And so health for me has always been not just about service provision. Health for me is a field where democracy is really playing out in real life. So if you need to access health services and you need to pay a bribe, or you need to have someone who you need to call, you need to have a connection, an introduction, if you need to sell a house to be able to afford the cancer treatments, that is not about the democracy. So, when citizens are not able to exercise their right to health, they lose trust in democratic institutions. And also poor health outcomes actually also lead to the democratic declines. This is a very, documented also correlation. So health story in Ukraine, therefore, for me, has become really, it's about democratic innovation. It's about also governance innovation. And so what Ukraine did to me is the impossible. So just to set the context to you of where it started, before 2016, so Ukraine, as many other countries in the region, had one of the most inefficient systems, most corrupt in the region. So public spending was only 3% of GDP, so that's half of the EU average. 50% of health spending came actually from households and not from the state. Families spent 40% of their income on medicine. And the financial incentives were aligned with the interest of pharma, of hospitals, of private providers, anyone but the people. And so the system was basically absorbing public money without producing public value. So therefore, the reform that Ukraine launched after a series of decentralized reforms was the most complex and serious and ambitious in Europe. And it didn't start with digitalization. It actually started with redesigning who has agency. And this was the most transformative in the reforms, that it started with actually how do we redesign the governance and financial structures around the agency. So that was the start. And in Ukraine, as you can imagine, this was the most radical way that you could go in terms of governance to transfer the power away from ministries, from monopolies, from pharma, from political discretion into the hands of people. So this was really the most challenging, I think, reform for implementation. And so to enable this, Ukraine started with the plural governance at the onset. If we need to transfer the agency from the states to people, let's start the design of the reform with people. So it formed a plural multi-sectoral governance board, which actually involved civil society organizations who led the development and implementation of the reform. So what did Ukraine do? So it launched upstream and downstream reform. So upstream, it meant that to transfer that agency, Ukraine needed a new governance infrastructure, innovation and governance, a more plural, a more open, a more transparent. So Ukraine created a new National Health Service of Ukraine. So that became a new purchaser, so an agency, right, that allocates money. It opened Prozoro, open procurement platform, e-health, the national verification system. So it basically created an open infrastructure and digitalized it. Most countries, and I've worked on health reform financing in a lot of countries, including Eastern Europe, most countries stop here and call it a success in terms of reform, right? When we build kind of an IT layer that becomes more visible. But for Ukraine, this was just the start. And so this also created just an enabling environment. So what made the reform actually real for Ukraine is that second stage that builds the system resilience. It was the downstream layer, the democratic participation that enabled the top layer to work. So the democratic participation was actually encoded directly into the financing logics, which I think is very much aligned with kind of how we think about plurality, right? So what does it mean? It implemented a very simple principle that sounds simple, more difficult to implement politically, that money follows the patients. Patients can choose their family doctor, right? And then money follows their choice. It is not following the choice of the minister. It doesn't follow the choice of the hospital director, of the pharma company. It follows the choice of the patients. And as simple as it sounds, it was actually a very revolutionary change in the governance and financing that Ukraine implemented. Open digital infrastructure enabled to create that layer, right? So 32 million declarations were signed between the patients and the doctors. And that meant that there were 32 million budget decisions that were being made by citizens, right, that influenced the budget allocation. So this was really a massive transfer of agency and power from political negotiation directly to people. And so this was an example of like engineering actually democracy into the public finance. And so then Ukraine didn't stop there either. So it enabled further bottom-up implementation of this. The participation required that all the civil society initiatives actually become institutionalized as a feedback loop into the system, right? So Ukraine created community oversight boards in hospitals, open budgets for public scrutiny. It enabled civil society really become the enforcement layer of that reform to create those feedback loops, right, between the upstream governance and open infrastructure and what's happening on the ground and who enables that agency to flow. And so civic tech platforms like Leaky of Ukraine, for example, they monitored medicine shortages and they reported it, or they monitored corruption in real times. Watchdogs looked at if there are any ghost patients registered and if there are inflated prices or violation of the guarantees. And so these little signals of the downstream democratic participation, most of them enabled through civic tech, then fed back into the feedback loop of the upstream reform. In most countries, actually, this upstream and downstream is very disconnected, and the role that civil society plays is more like a watchdog and observatory, right? And so Ukraine managed to implement that plural governance structure in the reform that integrated all those feedback mechanisms into the main reform channels. And so this interplay then between upstream governance innovation and downstream democratic participation is what actually made the digital infrastructure work. And it enabled the system then also to survive the shocks later on from a multiple number of ministers turning over, the COVID, and now the war, right? Because the digital infrastructure by itself, it created transparency and it created new rules for engagement. But agency was actually living with the people, and the feedback loops then created it all together and kind of enabled this interaction. So from this impossible story, and I say impossible because really at the level of transformation, and it happens in 3.5 years, from the state where Ukraine started to where we see Ukraine today, one of the most advanced actually systems in Europe, with a lot of the innovations, digital innovations that Ukraine presents, they are really the global innovations. The lessons I think that we can learn for building resilient democracies is that resilience, first of all, comes from people. It comes from civil society. It comes from communities on the ground, right? So it is civil society that enable that. So the feedback loops that create the networks of mutual accountabilities, right? Tech is an enabling factor. Yes, it creates transparency, accountability, and engagement mechanisms, but resilience is definitely with the people. And so Ukraine has done something that very few people, countries have managed. It actually rewritten completely the logic of public finance to place citizens and verification with the society and not with the states. And so that is really the transformation of the system. So I think as we talk today about digital innovation and democracy and resilience, I think the lesson that we should be really learning from Ukraine is how can we support Ukraine with the resilience that it has created, with the open transparency tools to shift the agency back, to people. As we rebuild Ukraine, but also as we learn, to export these lessons for the digital democracy, because Ukraine has really proven and showed to us that if you build agency with people, you build resilience. And if you manage to build the transparency, then this is where the trust is built. And then if you involve communities and civil society, then you involve them in co-governance, and this is how you strengthen democracy. So that's, I think, the story really of the impossible becoming possible. For us, I think also an innovation, but also inspiration and courage to think how we can scale that possibility across many different industries, across many different domains, to both for Ukraine, but also to strengthen democracies worldwide. Thank you.
Thank you so much, Katia. I love so much in that story, the story of the impossible, and this one line, downstream democratic participation is what enabled the upstream policy reform to work. This is a critical insight. So we will come back to this in the discussion. Thank you so much for your story.